ओंटारियो सरकार वालों एक बार फिर नवीं पाबंदियां का ऐलान किया गया है। इन्हां पाबंदियां तहत स्कूल इन परसन लर्निंग भी बंद कर दिए गए हैं। इंडोर डाइनिंग उत्ते पाबंदी लगा दी गई है। जिम बंद कर दिए गए हैं तो रिटेल कारोबारां लई भी कैपेसिटी लिमिट सैट कर दी गई है। स्कूल घट्टो घट्ट 17 जनवरी तक बंद रहेंगे। सरकार ने भी ऐलान किया है कि इंडोर इवेंट्स लई 5 लोग ते आउटडोर इवेंट्स लई 10 लोग इकट्ठे हो सकणगे। ये पाबंदियां 5 जनवरी तो शुरू होणगियां ते 21 दिनां लई जारी रहणगियां।
We need to implement measures that further reduce contacts and mobility. Effective Wednesday, January 5th at 12:01 a.m., Ontario will return to a modified Step 2 of the roadmap to reopen. The plan will be released before we confronted Omicron, laid out 2 clear reasons why we would implement province-wide measures. First, the introduction of a new variant. Second, if our healthcare system was threatened. Today, we face both of these. Our plan demands that we implement additional public health measures. Minister Elliott will share details with you shortly on what exactly this entails. But it will mean the closure of more indoor spaces where we know the risk of transmission is higher, especially with Omicron. But let me be clear, these will be targeted and they will be time limited. The immediate goal of these measures will be to blunt the latest wave so we can ease the pressure on our hospitals and allow more time to deliver these all-important booster shots, which continue at a tremendous pace.
And as Dr. Moore has continued to say, as the evidence on Omicron continues to evolve, our pandemic response must evolve with it. That's why, effective Wednesday, January 5th, the province will return to a modified version of Step 2 of the roadmap to reopen. These time-limited measures will help blunt transmission and preserve our hospital bed capacity. Measures include reducing social gathering limits to 5 people indoors and 10 people outdoors, requiring businesses and organizations to ensure employees work remotely unless the nature of their work requires them to be on site, closing indoor dining at restaurants, bars, and other food or drink establishments while permitting outdoor dining with restrictions, takeout, drive-through, and delivery, closing select indoor settings, including theaters, cinemas, and museums, but permitting outdoor establishments to open with restrictions, closing indoor sport and recreational facilities, including gyms, and permitting outdoor sport facilities to operate with certain requirements. Retail settings, including shopping malls, will operate at 50% capacity, along with personal care services. And indoor weddings, funerals, and religious services will be limited to 50% capacity, with outdoor services limited to the number of people that can maintain 2 meters of physical distance. In addition, on January 5th, the province will reinstate Directive 2 for hospitals and regulated health professionals, instructing hospitals to pause all non-emergent and non-urgent surgeries and procedures in order to preserve critical care and human resource capacity in the healthcare system. These measures will be in place for at least 21 days, until January 26, 2022, subject to trends and key indicators, and of course in consultation with Ontario's Chief Medical Officer of Health. I want everyone to know this was not an easy decision.